I'm always striving toward mastery. The more I practice, the luckier I get. I'm still trying to be perfect.
Dr. Ascher, congratulations on your selection as one of the 2025 American College of Surgeons Icons in Surgery.
It is my pleasure that Dr. Peter Stock is one of the individuals introducing me as an icon in surgery. I have known Peter for the last 43 years, first as an intern in 1982 and subsequently as a transplant fellow at the University of California, San Francisco. Following his fellowship, he joined our faculty and rose to full professor in 2004. He has been interested in pediatric kidney transplant, in pancreas and islet transplant, and actually has been the surgical director of the pediatric kidney program at UCSF, as well as the director of the kidney and pancreas program, co-director of the islet program. Dr. Stock has served as president of the American Society of Transplant Surgeons and chair of the ethics committee within UNOS as well as within the Transplantation Society. He is a recognized global leader in transplantation, and I am delighted that he has been my colleague and my friend all these years. Peter. I am delighted to have Hillary be one of my introducers as an icon in surgery. I've known Hillary since 2012 from the first day of her medical school at the University of California, San Francisco. She's been an absolute star during medical school, her residency at UCSF, and her transplant fellowship at UCSF. She is now poised and will join our faculty as a transplant surgeon this coming fall. And I'm delighted that as she begins her new career in transplantation, she helps me reflect on my long career in transplantation. Hillary has been interested in organ distribution and has studied travel for transplant both domestically as well as internationally. She earned her AOA during medical school and was the chapter co-president. She's won a number of awards and will continue to reflect very well on the UCSF Division of Transplantation. Thank you, Hillary.
One of the elements of your life that has been so remarkable to me is that you truly created a new path, both as a woman in surgery and as a transplant surgeon. You grew up in Detroit, Michigan, one of 4 children of a physician father and a mother who was a teacher. Tell us about how your parents and your siblings shaped your career decisions and the most important lessons they imparted on you.
It is true. I grew up in Detroit. My father was a physician and displayed his work ethic to us on a constant basis. We made house calls with him, and we actually had patients coming to our house for their care. My mother, a teacher, also instilled in us this incredible work ethic. Our parents were happy if we came home with a good report card, but we always kind of wanted to know why it wasn't perfect. So I got in the mode of striving for excellence. It helped that I was a third child and that I felt very competitive with my siblings. I wasn't the oldest, I wasn't the youngest, I wasn't the only boy, so I had a lot of competition growing up. I think that fueled my work.
Can you tell us a little bit about the Shut Up quiz?
Well, I'd be happy to tell you about it. I'm not sure that I would advocate it as a way to raise children, but every night at the dinner table, we had an opportunity to be asked questions by the quizmaster. We got to choose our topic. And if we got the question right, we could continue being in the conversation at dinner time. But if we got the question wrong, we had to stop talking.
Can you tell us how you got introduced to transplant and what attracted you about the budding field at that time?
So when I was first thinking about what career I wanted to do in surgery, I contemplated whether or not I should do surgical oncology or transplantation. Transplant seemed as though it were a field where I could combine patient care, technical excellence, and an opportunity to do research all together. And that was very attractive to me.
You were the first woman in the entire world to do a liver transplant. How did that feel? And did it occur to you in the moment that that was a really massive occasion?
Well, my first case doing a liver transplant was momentous for me, but it didn't occur to me that it was a step forward for womankind. I was just worried about the patient and myself. I have a teeny bit of problems considering it a big deal. Why is it that important that it's a woman who did did a transplant, as though it shouldn't be accepted? It was another surgeon who did a transplant. And so happened I am a woman.
A lot of your career was shaped without having someone to look up to. What kinds of guiding principles did you have when you didn't necessarily have someone's footsteps to follow?
Well, there were tons of role models. They just were not necessarily women. So I had many, many people to whom I looked up. Dr. Nigerian had incredible rapport with patients. He used to charm patients, and I learned other things from Dr. Sutherland and other things from Dr. Simmons. So did I miss having women around? Yes, because it's a teeny bit lonely to be in a room with, a sea of men. But in terms of modeling my behavior, I had plenty of role models.
So you came to UCSF in 1988 to start the liver transplant program. How did you think about who you were going to have on your team and what kinds of principles you wanted the program to really be fueled by?
Well, I have always put the patients in the center of our approach, whether it's the clinical work or the research work, and that has served me well. Once we developed a critical mass of activity, then we were able to attract people who wanted to do research with those patients, or other people who wanted to help us care for the patients. And my management style with those people, it was a relatively flat management style where everybody was kind of in the trenches together. And I think that really motivated everybody on the team to work together.
You then became the chair of surgery at UCSF and were chair of the department for 17 years. You really increased the number of women both on the faculty and in the surgical residency during your time.
So we didn't have to recruit women per se. Women were attracted to UCSF in the face of a female chair. So all we had to do was avail ourselves to the best candidates. As a consequence, we were able to get up to 50% female residents at UCSF and 35% female faculty when I was the chair. We gave people an opportunity based on their merit. If you ask women, do you want special treatment because you're a woman? Most of them will say no. They want to have an opportunity, and we need to give them an opportunity.
As someone who's about to start a career in transplant surgery, what advice would you give to young people?
So my bias is to establish yourself clinically, at the same time carving out a period of time where you're doing research. It doesn't have to be basic science research. It certainly could be clinical or outcomes research or policy research. But it's really important for you to progress along those two avenues, becoming the go-to person clinically and doing the research. At the same time, you have to start establishing yourself nationally and internationally in the field. So you have to join those organizations that will give you some visibility.
On the topic of confidence, I wanted to ask you if you have any advice or if you believe in the concept of imposter syndrome.
I think that we all sometimes feel that we could do a better job, or that we are not totally prepared for the job that we're doing. And the only way to get through that is to do the job and to do it better and better as you go. But I think if you let it get you, it's doom. That expression, I think it was Arnold Palmer who said it. Everyone says I'm so lucky, and I reply, the more I practice, the luckier I get. That's how I feel.
One of the things that we've said to each other a lot during the fellowship is that the only way out is through.
Well, but it's not just doing it over and over. It's doing it over and over with attempts at improvement. So it actually necessitates someone giving you feedback so that you get better with each stitch or each time you do something.
Do you think it has to do with sort of achieving mastery in one area and then trying to build on that?
So I think what happens is that your ambitions or your goals change as you go. When I started my career, all I wanted to do was transplant. And then as I got more mature, if you will. Then I wanted to run transplant and I wanted to become a department chair.
You've had many accomplishments in the field of transplant and a very successful career. What do you think is your most important contribution to liver transplant specifically?
I think the most important contribution that I and some colleagues made to the field of liver transplant was making liver transplant a clinical reality. In the past, the leaders started the field, but so few patients were able to do well after transplant. The outcome was about 20% 1 year of survival. And what my generation did was actually take that novel surgical procedure and make it into a clinical reality. So it became the optimal therapy for patients with end-stage liver disease.
Her real forte is developing a transplant team. You're the Pied Piper of transplantation.
We insisted on perfect surgical technique, and we were able to gather together a group of people who are all interested in doing the same thing. My management style was a relatively flat, where everybody was kind of in the trenches together. It's dependent on everyone trusting one another and everyone doing their respective job with integrity and honesty and with truth. So when I made an error, I didn't deny my error. And you've got to develop the environment where people can feel comfortable about saying, yes, I made that error and I can do it better.
A pivotal case that I remember from when I was an intern was Jamie Fisk. I wonder if you could maybe talk about how that case affected you.
Jamie Fisk was the young daughter of a hospital administrator from Boston. She had biliary atresia. Her father spoke before the American Academy of Pediatrics. They gave him a forum and he pleaded for an organ for his daughter. A family in Utah heard his plea. It was on the news. And when their baby became brain dead, they offered the organ specifically for Jamie Fisk. So I flew out to Utah to bring back the liver for Jamie Fisk. And then the case was famous because it highlighted, first of all, the number of children who were suffering from liver disease. It also highlighted the use of the media to promote organ donation. Jamie Fisk made an incredible transformation from being a very, very sick child near death to a normal little girl. Our field depends on the trust that the public has in the system and depends on the altruistic attitudes of both deceased donor families and live donors. And if we lose that trust, we will really be in trouble. It's very important that we make sure that those donors are treated ethically and at the highest level of medical care.
You donated a kidney to your sister. And can you tell us about how you came to be the donor and then what that experience was like, especially after having been on the surgeon side of the donor relationship for so many years?
My brother volunteered to be the donor. It turned out during his evaluation to be a donor, he had prostate cancer and he couldn't be the donor. So I was the next one in birth order. So it kind of became my honor to be the donor for my sister. But I was able to kind of come to that decision voluntarily and with joy.
Can you tell us a little bit about your experience as a patient in the hospital?
I consider myself to be an excellent patient. I walked immediately after my surgery. I took no narcotics. I was discharged on postoperative day number 1 after kidney donation. I wasn't the friendliest patient, but I feel like I was quite a compliant patient.
People may not know this, but if you walk 13 laps around 9 long, you get a t-shirt. Did you get a t-shirt?
I did. I was given a t-shirt, yes.
I know that you have a wonderful family who you care so much about. You love the opera, you love art. Can you talk about some of those things and how you've cultivated those interests throughout your career?
So when I was a little girl, my mother, she used to have 2 activities on Saturday. We'd either go to the Art Institute or we would go to monster movies. And so I developed a strong aversion to monster movies, but a great love of art. It's important for me to understand for a piece of art what the context was when it was made, what the political situation was. So the kind of intellectual surround of appreciating art is as important as my emotional response to a painting or a print.
And another thing that I know you like is the opera. What's your favorite opera?
Oh, well, how do you judge opera? The way I judge opera is that the story has to be good, but the music has to be great. And so La Traviata has many, many, many different arias or different scenes or different songs that are wonderful and that you leave at the opera humming or thinking about. Carmen's another one where there's just so many great songs and great melodies that you kind of think about the opera long after you're gone.
Oh, Nancy, if it was 1982 again, would you choose transplant again?
Yes, absolutely. I wanted a field that would keep me interested, 5 years, 10 years, 20 years, and now it's been 40 years. So yeah, I would do it again.
Do you think it's lost its luster, or is it still there?
I think transplant still has tremendous luster. We have to figure out a way to bring these people back from what they're facing, which is certain death without transplant. As the field evolves, it allows us to change, it allows us to do outstanding work, and it allows us to help patients.
Intense, perfectionist, maybe stubborn. You were very cool, and the reason people followed you not only was your competence, but you just had this clear love of what you were doing, and you did it in a way that was a lot of fun. I think maybe that's evolved over the years as you've got more and more responsibility. It's a lot easier to have a little bit of a looser attitude or a more fun attitude until you have to run the show. So she was just a ton of fun, and just leave it at that.
The people who are interested in medicine now, they're interested in it because they really love it. You have to love it to go into it. We really need to attract and interact and support those people who want to be in the field because they love it, because they're interested in helping people. Are we done now?